Hello, how are you? And you hope you're doing great. My name is Winnie Barawa, and we are back on our series on the nursing care plans. So, in this current class, I want to give it more time and highlight each and every step slowly but sure, because it's one of the areas that, unless you understand what to do at that particular area, somehow you may feel like you got lost somewhere. So for those who've been following, we started this series with introducing what a care plan is. We looked at the advantages of writing a care plan. We went ahead and looked at the types of care plan, including both formal and informal, highlighted at the individualized care plans and the standard care plans. And then we looked at what are the tips you need in writing an individualized care plan. And in all that, later on, we came and looked at the components of the nursing care plan. So if you've not watched those videos, kindly have put in the description below the links and where you can catch up on all those areas so that you can be at par with us. So you can do that in the course of your own time. But in this class, I just want to focus more on the nursing care plan, how to write it, or what do you need to know first before you start writing. So this is a 9-step that I will use so that we can flow together and have it easy. So let's flow together. So these are decided to call them the simple steps to writing a nursing care plan. And it will copy the components, but in an expanded way, so that you're able to now understand when we are saying assessment, what did we mean we need to do in that particular stage. So the first step is data collection or assessment. And here we will do more of a recap, because in data collection and assessment, the first step here is for us to obtain as much details as possible about our patient health status. And I will repeat, you are not doing this based only on physical examination. And this is why I say most of us fail, because we consider assessment or data collection about our patient's information is just by conducting physical examination. No. Fine, you will do physical examination, but you need to back it up with more information collected from other areas. Do history taking, do interviews, review the medical records, check some diagnostic studies that have been done around this patient. So you need data about your patient as the first step of your nursing care writing, but do it comprehensively. Do not just stick to only physical examination and close it there. No. Combine it with other sources, history, interviews, medical reviews, diagnostic studies, patient verbalizations, and what you generally have observed as you take care of this patient. And then the second step is data analysis and organizing of this data. So remember, above in the first step, you've collected data, you've collected information around patient health status. For example, let's use respiratory disorders. So this is a patient possibly when it comes to symptoms, which you will see under physical examination. You'll find symptoms like coughing, change in temperatures, change in a breathing pattern. Those are the data you will collect on physical examination. But you'll also realize when you do history taking, you'll find the patient has history, maybe where they stay, there's some environmental pollution there, or there's some issues that are promoting respiratory illnesses. When you keep on now and review medical records, you may realize when there was a chest x-ray done, or where there was some respiratory functioning test done, there were some more details that came out of it, like consolidation in the lungs and so on. Pick all that data and now put it in a way that there's relations. So if it's data that is relating to the breathing system, put it down there. If there's data relating to issues like blood flow, put it in one category. If there's data relating to nutrition, you put it together. So you are analyzing and organizing the data. Why are we doing that? You are doing that because it will generate areas of priority. So if you find there's data around anxiety and emotional instability, put all that data in one category so that when we now go to the next steps of looking at how do we intervene, you will know, okay, I found some problems or issues around nutrition, what interventions will I put? I found some problem relating to breathing system, what can I do? Because you need to organize that data based on the data that you collected and which areas are getting affected. So after getting this data, step 3 is formulating the nursing diagnosis. We discussed earlier that in the formulation of nursing diagnosis, you can start with the NANDA. So this is like a booklet that discusses all the possible nursing diagnoses in the nursing fraternity. So NANDA in full means the North American Nursing Diagnosis Association, and it's a way of getting uniform diagnosis for all the nurses in the world. Like this NANDA, you'll find it everywhere in the world. It's not somewhere confined in just one particular region. So these diagnoses are uniform in such a way that if someone is mentioning things like fluid deficit, you'll still find it also in Europe talking about fluid deficit. In America, you'll find fluid deficit, and even in African setting, you'll still find the same diagnosis being highlighted. So it's a uniform way of identifying and focusing on, and helps in dealing with specific client needs and responses. So you will discover that in the previous steps where I said analyze and organize your data. So if you found data in the pathophysiology part on respiratory system, you will put that data together. If you found data showing problems with nutrition, you will put that data together. Why are we doing that? When you do that, when you go to NANDA and nutrition, you will find diagnoses highlighting those parts on nutrition. So you will pick that data relating to it. For students, most of them, they like cramming. I advise you don't cram. Instead, always refer to NANDA and see the data that I got, does it analyze it and have a specific NANDA diagnosis that can help me get the correct description for it. Because most of us, they try to cram and now they will generate this nursing diagnosis that don't exist, or they start generating this descriptions of a nursing diagnosis that don't even make sense. So for these NANDAs, kindly use a NANDA. And like I said, also you can still find in the internet references of books that have been written around nursing diagnosis. And right now there are so many, and they'll give you so many options of which diagnosis you can use. The good part is most of them originated from NANDA. So they're literally a replica of NANDA, but has been discussed in an elaborate and well outlined way. And the fourth step is setting priorities. So when you have formulated the nursing diagnosis, we are supposed to have priorities. Priorities means start with the high risk going to the low risk. So there's some diagnoses you cannot put them as the last one. So by priority means the nursing diagnosis, when you put it as the first one, it means this is the one you're going to put your most energy in. So you do not want to put something that is not of priority at that particular time. For example, let's take a patient who is critical, or a patient who is in a critical level, and this is a patient who is dealing with circulation problems, or they have high blood pressure, and the values are just on the skyrocketing. Now, if you're dealing with such a patient who is having hypertensive crisis, and instead of dealing with the unstable vitals, you put above at the first level for you want to handle is counseling, or rather emotional balance. We will be worried because this person has fluid balance issues or fluid hemodynamics are not met. So as a result, we will be waiting for you to put the hypertensive crisis as the priority diagnosis, meaning we expect it to be the first one on the chart, not the third or the fourth on the list. So we expect you to know how to rank your diagnosis, or rather to rank your areas of organization. So if you put nutrition and all those things that you've grouped, you need to know which one now is to be prioritized in your nursing care plan. So put your nursing priorities in terms of severity. If something is severely and needs to be immediately dealt with, please put it as the first one. and keep on analyzing and see which one is medium so that you go into the next level. If it's low priority, then you can even put it as the last one. But it's always emphasized that the life-threatening problems or issues need to be given the highest priorities. So you can, however, prioritize your nursing diagnosis based on different criteria. It's not just individual criteria. You can use many criteria. Some people prefer using Maslow's hierarchy of needs, whereby you have the physiological, belonging, self-actualization, and all those. You can still use Maslow's. Others use the functional level when it comes to setting priorities. Others will prefer using the pathophysiology. But at the end of the day, always have a rationale of how you came up with the criteria of prioritizing your nursing diagnosis. And step 5 is establishing the client goals and desired outcome. So don't worry about the congestion here, is because I needed to give an example so that as I speak, I can reference how you bring it out. So remember, in the components, we mentioned an aspect of goal and planning. So in the 5th step of establishing the client goals and desired outcomes, remember the goals and outcomes can also be short or long term. In the short-term goals, these ones are achievable within a short period of time, like a day or just a few days. Some are within hours, others are within minutes. However, when establishing these client goals, you need to be smart, or rather we need to apply the criteria of SMART goals. And SMART goals here, we mean goals that are specific, measurable, attainable, realistic, and time-bound. You don't want to just be writing goals that don't make sense. So the goals are describing for us what the nurse is hoping to achieve as they implement these interventions. So when you're putting these interventions, let's say the temperature is high and you want to intervene with giving antipyretic medication, it is your anticipation that your temperature will go down. But it's always asked, what is your anticipation? After how long do you expect the temperature to go down? Is it 30 minutes? Is it 1 hour? Is it 2 hours? So you're supposed to give specific time that you expect this temperature to go down. And that's why we say SMART but specific. So that goal is measurable but it's specific. And then you can ask yourself, that temperature that you're expecting to go down within an hour, is it measurable? Is it attainable? How will you measure and how will you know it has been attained? So you'll come do your review or you'll do your repeat of temperature check and you can measure if it has made sense. But you need to know the goal has to be specific, measurable, attainable, realistic, and time-bound. That's what I needed to emphasize. So let's look at some examples of nursing goals that were written for different diagnoses of patient. So you have a patient here who have a decreased cardiac output because they are suffering from heart failure. And this patient, this nurse generated a goal that the client will demonstrate adequate cardiac output as evidenced by vital signs which are within acceptable limits with absence of dysarrhythmias and no symptoms of heart failure. This looks fair to me. Makes sense because the nurse is expecting a demonstration of adequate cardiac output, and what are they expecting to see? Vital signs that are within acceptable limits, absence of dysarrhythmias, and absence of symptoms of heart failure. The only thing I feel is missing in this goal is the time. So within what time? Within what time is she anticipating to see these changes? So like we said, we need the time bound, which is missing. So when you write your goal down, you need to check if this is making sense. Is there some specificity in it? Is there some measure of attainment? Is it realistic? And you have the time bound. The second example is this one of a patient with ineffective airway clearance due to pneumonia diagnosis. So this one now is bringing in more details, and I like this one where she's saying after 8 hours of nursing intervention, the patient will display signs of effective airway clearance as evidenced by what? Absence of dyspnea, cyanosis, and respiratory rate that is within range of 12 to 16 breaths per minute. Perfect. So let's tick this diagnosis by looking at, have they achieved our smartness? Is it smart? There's time specificity, nice, so 8 hours. Are they showing the measurability of criteria? Is there what they expect to see? So there's display of outcome. So there's effective airway clearance with evidence of absence of dyspnea. There's no cyanosis. The respiratory rate has been achieved back to 12 to 16 breaths per minute. This is good. This is good. And the difference between the two is that I advise people or students, just ensure you have covered at least 50% of this smartness if planning to achieve the goals you have set in the previous step. So if your goal is to achieve normal respiratory rates of 12 to 16, then what activities or actions are you planning to intervene here? So here this step focuses more on the selection of nursing interventions. And now this brings that into the types of interventions that a nurse can select. So there are two types of nursing interventions here. Three. So we have the independent nursing interventions, the dependent and the collaborative nursing interventions. I'll give examples of this later on, but let's just highlight them briefly on what they mean. So the independent nursing interventions, these are activities that nurses are licensed to initiate based on their sound judgment and skills. They're interventions where a nurse may not really need to consult on what he or she should intervene, because they're already automatically licensed to do that. However, they are what we call the dependent nursing interventions, or rather these activities that are carried out under the physician's instructions and guidance. So for instance, when it comes like dose estimations, as much as due to experience and you working in a particular department, you will have the experience and the exposure into even dosage calculations and prescription of dosages. The nursing fraternity have not yet achieved the right to start prescribing medication, but that is normally given under the physician's instructions and guidance. But some nurses are so good at it, like they literally know after this drug I need to give it this amount this way, but always it's under the guidance. But that's why we are calling it the dependent nursing interventions. The other interventions you may need are what we call collaborative. This is an intervention that needs the nurse to carry it in terms of consultation with other health team members. For example, if in your care plan you anticipate physio exercises, you may not start intervening there giving physiotherapy care. You will have to call the physiotherapist to come in and implement the physiotherapy exercises. So depending on what is on your nursing care plan, you will have to collaborate. You may have to seek instructions, or you can operate independently based on the activities that require to be implemented at that particular time. So here are the types. Like in the case of independent nursing interventions, a nurse has the freedom, to auscultate and do physical examination on that patient. They are allowed to document any findings they find on their patient that is abnormal and will need further interventions. The other dependent nursing interventions, a nurse may depend on, in this case now, the prescriptions for her to administer. Even if she knows, she will need the doctor to certify that, because it's not within her licensure to offer such services. So those are examples of dependent interventions. But on the collaborative aspect, like where I given an example, physiotherapy, occupational therapy, nutritional diets, diets, these are collaborative activities that she may need to consult and work together with fellow healthcare team members. And so in the rationales, this is a stage where, based on the intervention you've picked, whether it's independent, dependent, or collaborative, you need to give a rationale. So despite nursing being an art or ability for you to implement all these activities, it's also a science. So you need to give a scientific explanation as to why you have chosen the specific nursing interventions. So as we keep on, you will see some nursing care plans have a column where you will fill rationales, but it's always good you have a rationale for each and every intervention that you give. So for example, let's use this care plan that was written by a nurse somewhere, where they had the nursing intervention where she will perform a comprehensive assessment of pain, where she will determine the location, characteristics, the onset of the pain, duration, frequency, quality, and severity of the pain via the assessment. The rationale why she picked this intervention according to the nurse at that particular time is that patient experiencing pain is the most reliable source of information about their pain. So the assessment of pain by conducting an interview will help the nurse in planning optimal pain management strategies. So give us a reason why you want to intervene in that particular aspect and rationalize it by giving a reason why. So the rationale is just another term for why are you picking that particular intervention. So you need to explain it. And stage 8 is about evaluation. So at the evaluation level, here you are giving a monitoring of the current status your patient is at. So this is a planned, ongoing, purposeful activity in which the client progress towards achieving goals or desired outcome is assessed, and the effectiveness of the nursing care plan. So this step will help to determine whether the interventions should be terminated, continued, or changed. So the evaluation level is a very important aspect because you're able to determine whether the interventions you need to either terminate, continue, or change. In some cases, you can use the evaluation finding to determine whether you can discharge your patient home or continue with management in the wards. The last step now is us as nurses putting it on paper and documenting it, but you need to know that the documentation will focus on the hospital policy, or it will be based on the hospital policy, whereby the nursing care plan will become part of the patient medical record, and it can be used and reviewed by the oncoming nurses. And there are 3 possible outcomes as we take care of our patient. You can either indicate either the goals have been met, the goals are still ongoing, or the goals were not met. So you can decide whether you terminate, continue, or change. So thank you so much for being part of this family. And like we have reinstated, is that this is a series focusing on nursing care plans, looking at how to make it better, simplify it, and help all of us be better nurses as we work around our nursing care plan. So remember, if you wish to know our next class and when I post a next session on the nursing care plans, remember to subscribe or click the subscribe button and click on the notification bell so that when a video comes up on our channel, you can catch it up on time.